I've been a nurse at the front lines for 30 years, and I would say year by year it is getting more and more difficult to meet our standards of care. The care has definitely gone downward. So just in January of this year, in 2016, our CEO, they've made cuts to Windsor Regional, 169 RN positions. We have to make a voice now for all Ontarians. Because I think with these cuts, they're putting us in a crisis, and the public will start to think that maybe privatization or a two-tier will help. But that's not, this can be reconciled. This can be done universal health care. And as a nurse, I just need to be advocate for my patient, I do. And I know it has to stop now. It really does.
How I'm being affected by the cuts in Windsor, Ontario is where I am part of an outpatient clinic. And because we are funded through global budget in the hospital, and because the hospitals aren't being funded properly, our outpatient clinic is being closed in our area. So diabetes education is supposed to be diverted into the community and to programs, but there's no pathway that we see that's available to provide those services. So although it seems to be needed to get our expenses out of the hospital, they don't have a place for the 4,500 people we serve to go.
Nurses save lives. Nurses provide exceptional care to patients. And nurses know how important health care is to the people of Ontario. No matter who you are, no matter where you live, no matter how much money you make, your health and the health of your family comes first. And it should come first for the government too.
It's my pleasure to rise today on behalf of my community of Windsor West on the first day of Nursing Week in Ontario. Our dedicated and professional nurses are critical to delivering the quality health care people living in this province know and deserve. Today, I'm joined by some of these caregivers from my riding, and I thank them for taking the time to come to Queen's Park.
Stop RN cuts!
Thank you so much, Mr. Speaker. I'd like to welcome to the Legislature a group of nurses from Hamilton representing ONA. Welcome to Queen's Park.
So nurses are here from Hamilton today to speak out against the cuts to registered nursing positions and to the base funding for healthcare. There is no escalator to account for inflationary costs or population growth. We are finding that we are working harder and we are trying to provide patient care, and we are unable to do so. We are afraid that all of these cuts to quality registered nurses, and especially in acute care settings, will create increased deaths for our patients, increased risk to our patient, increased illness, increased returns to hospital, increased length of stay, so increased wait times in our emergency departments and in the units. So all of these cuts are affecting our patients and our families, and we are speaking out against that because we do not feel that the government is appropriately funding, base funding for healthcare as well as for hospitals.
The member for Sarnia-Lambton.
Thank you, Speaker. I have a petition here from Tracy Stebbin from my riding, registered nurse, to the Legislative Assembly of Ontario.
Whereas providing high-quality, universal public health care is crucial for a fair and thriving Ontario.
And whereas years of underfunding have resulted in cuts to registered nurses and hurt patient care, and whereas in 2015 alone, Ontario lost more than 1.5 million hours of nursing care due to cuts.
And whereas procedures are being offloaded into private clinics not subject to hospital legislation, and whereas funded services are being cut from hospitals and are not being provided in the community, and whereas cutting skilled care means patients suffer more complications, readmissions, and death.
Therefore, we, the undersigned, petition the Legislative Assembly of Ontario as follows.
Implement a moratorium on RN cuts.
Commit to restoring hospital-based operating funding to at least cover the cost of inflation and population growth.
Create a fully funded multi-year health human resource plan to bring Ontario's ratio of registered nurse to population up to the national average.
Ensure hospitals have enough resources to continue providing safe, quality and integrated care for clinical procedures.
And stop plans for moving such procedures into private, unaccountable clinics. On behalf of myself, the member from Windsor-Tecumseh, and the member from Essex, we fully support this petition.
Nurses, no! Stop RN